Matt B., do you see street epistemology as a substitute for cult exit counseling? Are the two techniques equivalent? I've been thinking about this for some time now. There's obviously some overlap in that both methods involve questions to stimulate critical thinking about fervent belief, but there are some fundamental, if subtle, distinctions. As I understand it, cult exit counseling has a basis in psychotherapy, while street epistemology is more grounded in philosophy. Some cult exit counselors have raised concerns that street epistemology is not therapeutic, especially when applied to a victim of traumatic abuse like most ex-cult members. I'd like to know what you think. Matt, thank you very much for this question. It's a very good one because there is a distinct and very important differences between doing cult exit counseling and street epistemology. For one, I don't know who the person you're referring to here when you say some cult exit counselors have raised concerns that street epistemology is not therapeutic in your question, but it's never intended to be. Street epistemology is a method of discourse to gain better understanding between two people, or to help somebody gain a better insight or understanding as to where they might have considered or gotten some ideas that they hold dear. And, why do you hold those ideas dear? Where does that idea come from? Have you ever questioned it? What about that idea gives you satisfaction or support or whatever? There's lots of ways and things you could ask in street epistemology that are meant to sort of give a person a little bit more insight into their logic and epistemology, their basis for their understanding what they feel they understand. And it's a conversation. It's meant to be friendly. It's meant to be a rational, friendly discourse. It's not meant to be therapeutic in any way. I am absolutely positive of that. So it's different paradigm, really. When you're doing cult exit counseling or you're helping somebody therapeutically recover from a cult, you're applying treatment modalities to them as a trained therapist. And this is a licensed activity for a reason, because it delves into very sensitive areas for people. And it's a step-by-step process, no matter what therapy, modality you're using. Now, if you're talking about a more light grade sort of, advice or, consultation, like with what I do, where I will work with people who have come out of cult situations or coercive situations, that's educational. That's advice, guidance, direction. It's not therapy. I've stressed that over and over again. In fact, every single time I talk about the kind of consultation work that I do, I say the words, it's not therapy. Because it's not. Therapy, again, is incisive, it's invasive, it's personal, it's sensitive, and you got to kind of be trained and know what you're doing. That's the whole reason we have licensing boards and therapists who go to school and do internships and learn what the hell they're doing. That's not what I'm doing. When I'm working with somebody, I'm trying to educate them. And education is separate from therapy, although they're very, very, or can be very, very related. But they're not the same, right? If I have you go read books or read articles or essays or even do writing exercises or something, that's not therapy, and it's not pretending to be, right? So these are very different things, and street epistemology is something that I very much support and very much believe in as a practice, because I do believe it's the one way that we can use to better understand one another. See, street epistemology often is positioned as a one-way flow, where the interlocutor, the questioner, the person who's asking the questions, is meant to come at this from this position. Well, I know there isn't a God, let's say, and I'm going to talk to you, but instead of telling you that or debating with you, I'm going to ask you questions of an incisive nature about where you're feeling or knowing this information is true or correct. And you tell me what you think, right? Like, well, where did you get that idea? Why do you think that's correct? What does that idea do for you? These are good questions to dig into why a person has beliefs in almost anything, whether it's God or a culture war value or some social value, because it's just kind of exploratory conversation. But it also helps the questioner as much as it does the person who's answering the questions, if they're open to having their own minds changed. in the process of doing their questioning, maybe they also can look to themselves and look at what they believe or think is true, and why do they think so? And it can actually become, a two-way conversation, which I don't think is a bad thing. That's what we want, is good, rational discourse. So that's, but when you're doing therapy or cult exit counseling, it's not that way. The person who's administering the therapy or the counseling is not sitting there expecting to have their mind changed about the cult. I'm not going to do work with somebody, and a therapist isn't going to do work with somebody who comes out of Scientology, listen to what they have to say about Scientology and go, oh, that's a good point. Oh, I think Hubbard had it right about that. That's not the point or the purpose of the activity at all. So there's another distinction between those two practices. And I've had conversations with Anthony Magnabosco on my podcast a few times about street epistemology. I really highly recommend, if you haven't seen those, that you check them out so that it's clear what the differences and similarities are between these things. Here's the question somebody asked me. Do you see street epistemology as a substitute for cult exit counseling? Are the two techniques equivalent? I've been thinking about this for some time now. There is obviously some overlap in that both methods involve questions to stimulate critical thinking about fervent belief. But there are some fundamental, if subtle, distinctions. As I understand it, cult exit counseling has a basis in psychotherapy, while street epistemology is more grounded in philosophy. Some cult exit counselors have raised concerns not therapists, cult exit counselors have raised concerns that street epistemology is not therapeutic, especially when applied to a victim of traumatic abuse like most ex-cult members. I'd like to know what you think. And what I said was that street epistemology is not trying to be therapeutic. It's not even pretending to be that. It's not that at all. It's a method of inquiry, and I described it like we've been talking about it today. And I said it's very, very useful, and the methodology is very akin to what we do in interventions, but it's not the same thing at all as post-cult exit counseling, which is more in the therapeutic direction,
So I'm not familiar with post-cult exiting, although when I look at the materials that are being produced by people in that space and the techniques that they're talking about, there is some similarity. And as I mentioned earlier, SE is a mix of philosophy and psychology. We're cognizant of it, but I wouldn't call it therapeutic.
Right.
When you mentioned, we were talking about the course a little bit, we actually brought in a couple of people. And in fact, we have a member on the team who is a family psychologist, something like that. And we were wondering ourselves, what are the similarities and differences here? And one of the major differences that we've noticed, and this is why I would say SE is not therapeutic, is that we're concerned with how you've decided that you have a good reason for thinking something is true to some degree of confidence. And if you give a reason, we're going to interrogate the quality of that reason with you. And the result of that might be you realizing that it's not a good reason. And I don't know if that is exactly what happens in therapy. My understanding from talking to therapists is that, and maybe this is controversial or maybe this is on the nose, I don't know, that a therapist will help you reveal solutions that you think you need to deal with a hardship and to fix your problem, as I understand it. And maybe they're not as concerned about that solution being grounded in reality. As long as it serves your need and helps you, awesome. That's my understanding about therapy, and maybe that's not it. Maybe again.
No, I think that's a fairly accurate rendition from an objective point of view, because therapy is not about trying to dictate or tell somebody how to live their life. That's what the cult was doing. And what you're trying to do is return the person's power of choice, willingness, their own point of view, their own identification of their own self-image, not the cult image that was laid over that. Those are the things you're trying to sort of get the person to sort of strip down or take off or remove from themselves as you deal with them in a post-cult situation. And that's therapy. And there's lots and lots of approaches to it, from art therapy to talk therapy, to emotion-focused therapy, to trauma-focused therapy. There's a lot of approaches to dealing with the residue and consequences of cults and cult thinking. And none of that would be classified as or look anything like street epistemology.
Okay.
Right? And street epistemology would be useful as a technique of interrogating belief and understanding of things, and could be very useful in that setting, but only as part of a bigger picture. It's not designed to be therapeutic. And you could introduce it to a therapy scenario and use it, and I think it could have utility in certain circumstances, absolutely, but it's not a therapy modality. And I think that there is a very clear divide between those two things.
I think that's it. And like in street epistemology, we want to help our conversation partner recognize to their own satisfaction, if it's the case, that their reason isn't solid or as high of a quality as they think that it is. Right. And there's implications for that discovery that could be problematic for the person. So like, I think in SE, we tend to err more on the side of accuracy and truth as opposed to pragmatism and serviceability or the usefulness that I get from the belief. Right. And maybe that's a key distinction there.
Well, it could be because it could well be, and it would never, ever be a psychologist's place or a therapist's place to counter or deny a person if they come in one day and say, I'm feeling so much better now because I found a new belief system.
Right. Regardless of whether it's true or not. And that's the difference. I think the SEer is usually motivated by like a strong desire to align their beliefs and hopefully the beliefs of the people around them with the accuracy of the situation.
That's right.
And I think there's a lot more leeway once you get more into the psychotherapy route or the therapy route, the therapeutic route.
Very much so. Very much so.
It's interesting to note, though, that I've received probably 5 to 10 emails over the years from therapists who have stumbled across SE videos who have said, that's amazing, I love it, and I started to incorporate it into my practice. Mm-hmm. And I don't know what to make of that.
Well, like I said, I think it can be utilized in select circumstances in a targeted way to assist a person to understand why they think or act the way they do.
Maybe so. Yeah, I mean that's
no
the point of it. That's the purpose of it.
Exactly.
So I can see the value of it. I just wonder. Yeah, I just wonder at what's their cutoff. You know, at what point would they not want to interrogate their patient's beliefs? I guess they would probably leave it up to the patient. That's what we would do with somebody on the street or a family member or friend.
That's right.
How is this going?
Can
I ask you more questions? Is this disturbing to you? We can take a break. Ask me questions in return.
That's right.
We do try to be cognizant of the impact that it can have, because we want people to be rational, critical thinkers because we think it'll be better for society. Well, that is the global goal driving this whole project.
That's right.
And there are people out there who don't find that quite as important. And
well, it's interesting what people think. It's interesting to me what people think other people think they need, you know, and there are very disparate views on this. And that's okay. Different cultures, different education levels, different backgrounds take on these things in different ways. Totally fine. I don't know that there is a one-size-fits-all answer uniformly for all human beings as to how they become their best selves. But I think that when the context calls for it, or it looks appropriate, or, you know, fitting to the situation, a therapist would be perfectly in alignment with the patient's needs to utilize this method of inquiry as a way of getting the person to explore their own thinking. That's fine. But that used in conjunction with other modalities in a therapeutic environment where there are ethical guidelines and boundaries restricting the behavior of the therapist, fine, go for it. Use it there in that context. But let's not equate that with what you're doing on the street.
Right.
Different purpose.
I do wonder, though, in 10 years, if this keeps growing at the rate that it seems to be growing and getting people's attention and we're refining it. This is a worldwide community effort where we analyze videos. We break down what we're doing. We spend like the course. We talk about what we're doing. I do wonder at some point if we will reach the stage where there needs to be some sort of oversight, or I don't know. Because right now, a large part of the growth that you're seeing in SE is because there's no ethical body governing what it is that we're doing. We can do whatever we want, and we can throw it up against the community and see what sticks. And well, we're getting pushback on this. Maybe we need to tweak that. So there is, in a way, I guess there is a community of people, but it's not like an official thing. We can't get a citation to stop doing SE or anything. Anybody can do pretty much whatever they want. But that freedom has led to so much experimentation. It's made SE better.
And as it should.
Freedom is made.
Yeah.
But I do wonder, would we ever reach a point where there's some sort of ethical ceiling that we hit?
Probably.
You know,
Probably.
Yeah, maybe.
Dealing with what you're dealing with, I think that it would be a fairly natural evolution to develop some sort of ethics code or guidelines for street epistemologists in the same way. We do have one in the course. Yeah, well, in the same way that there are ethical codes and guidelines put down by licensing groups or the APA or the AMA for, for the healing professions. Sure, and we're talking. We have a module. It's the third module in the course. So module 1 is what is street epistemology. Module 2, why use it? What are the goals? Module 3, the ethical considerations, where we talk about the ethics that we think, based on our experience, you should probably have when you attempt to use this approach with somebody. Yeah. But who enforces it? Like, I can't do it. I mean, we have a nonprofit organization that's intent on getting these tools into people's hands, but let's say there was an infraction out there of some kind. Like, well, whose responsibility is it to tap that person on the shoulder and say, don't do that anymore? Right. I don't know. No, it's actually, you'd have to set up a more formal structure and framework with licensing bodies or certifications or something like that. Those are bigger questions than they're above my pay grade right now. But what I'll tell you what, though, is I'm very, very happy to see, and I think the audience should acknowledge the fact that, you guys are taking these questions on very seriously this early on in the whole process. I mean, that's a big feather in your cap, just to let you know, because this is potentially a set of tools that could be utilized by bad actors in a manipulative way. And so, putting something there saying, don't do that, is in itself a good thing, I think it helps to have something out there, even if you can't enforce it. We do have it in writing that the 2 ethical principles to adhere to, this is module 3, is being honest and attempting to promote well-being. Yes. And if you have those as your groundings, you're going to probably be in good shape. Yep. Yeah. So, because it's hard to be too transparent. So if you're just being transparent with what you're doing, and you're coming at it from a point of view of goodwill or good intent, it should work out. I think it puts you, it helps make it more ethical the more you reveal about what you're up to. Right. And checking in, that idea of informed consent goes a long way. That's right. And being willing to have them ask you questions in return. If you all do, and they're hopefully they're in control and they know what you're up to and they're a participant. You're collaborating with them. You're not doing this on them. You're doing this with them. Exactly. And as long as you have that, I think you're in good shape. And we've recognized this early on. Like when I started going out, and this is post Street Preachers, because I was still arguing with them and like that wasn't good. But like very early on, when you start asking people to explain how they've reasoned to their conclusion
and they feel safe and they're revealing these things and you're asking these questions, and you do notice the destabilizing impact that it could be having on their confidence in their conclusion and all the trappings that come with it, right? Like, oh, maybe I need to leave this tribe now because I don't think that this is true. Like, that's a big deal. When you're having that conversation with somebody and you can see, and they'll even verbalize the difficulty, it dawns on you very quickly that there's something profound, something very profound could happen during these talks, and there's a responsibility that you have as a practitioner.
I am so glad you just said that, because it's the only thing that I've ever heard that is actually parallel with or akin to something that a very experienced cult interventionist told me many years ago, that I took to heart and have kept close to myself ever since, because it was such a powerful statement. He said, look, there's something you have to understand about going out and doing an intervention with somebody. And you're going to have to get your head around this, right? Which is that you are taking it upon yourself to go change this other person's life. Right now, they're happy with their life. And you're taking it upon yourself to go out and change that person's mind in an incredibly significant way. And you got to be responsible for what you're doing. It's not a half-assed operation going and doing a cult intervention with somebody. And you have to be responsible for what the effect you're trying to create on this person's life. And that responsibility starts with acknowledging what you're actually doing.
Yes, and being honest with yourself and with them.
That's right.
Because it's going to get out anyways through your questions about what you're up to. So you might as well just be straight with people.
That's right.
We talk about the steps of SE, like identify the claim and get to the reasons and uncover how they determine. That's the epistemology part. How did you determine that that's a good reason? And there's all sorts of steps, but there's a step 0 that and David McRaney mentions this in his book, and I'm so glad that he mentions it. Step 0 is really asking yourself, what am I trying to do here? And being honest with yourself and having that grounding. And if you've got that, then the rest of it should be good to go.
Exactly. Because if you think what you're about to do is wrong, is morally challenging, is somehow a dilemma for you, then you shouldn't be doing it. Because you're not in the right headspace for it, for one, and two, you think it's wrong. Well, don't go doing things to other people that you think is wrong. You know, I mean, it's kind of like one of those sort of duh things, but sometimes it needs to be said out loud, because this is one of the things in doing an intervention that you have to get the whole family or the people who are involved. Everybody's got to be on the same page. And every time I've been involved in some intervention situation where it didn't work out, almost uniformly, it was because everybody wasn't on the same page before we even got started.
Interesting.
Very interesting. And something to keep in mind, you know, is the success of this sort of thing is very dependent on everybody's attitude going into it. And openness, honesty, and transparency are actually key components of a successful intervention. Getting the person into the chair to have the conversation is the hard part. And then once you get them there, then it's an open conversation. It's not trickery and manipulation and kidnapping and beating and forcing anything. That's old school crap. We don't do that anymore. And when you do it now, it's about, it looks an awful lot like a conversation.
It should be.
And it should be.
It should be.
Exactly.
It should be. It's tough because there are technical components that you want to hit when you're doing SE. Which could make it seem like it's this technique and it's this thing you do. But like ideally, you're asking questions to truly understand and generate reflection and allowing them to really take a look at their own views in a critical way. That's all it is.
And that's practically a word-for-word description of what an intervention conversation is.
Yeah, it's interesting. Would you say that those are more happening with like, it's like a 5-on-1 type of thing or 10-on-1? Are interventions ever a 1-on-1?
No, they ideally they're 1 or 2-on-1. You don't want to group up on somebody because that creates a whole level of social pressure dynamic that you just don't want in the room.
Are there any videos of people doing this? Because it would be fun to do a breakdown video of a cult exiting interview.
Yeah, I've never seen a video of it. An intervention. Yeah, let's call it that. Because a cult exit counseling is more of a therapeutic thing, Whereas the intervention is not a therapy process. It's literally an intervention, whether it's drugs or cults or alcohol or whatever it is. You know,
I would love to watch one.
Yeah. And those kind of, and it can be a group thing where you have a number of people, you know, telling the person what's up and what their views are and stuff. But a cult intervention tends to be a little bit different because the nature of the beast is not a substance abuse. It's a thought abuse. It's a psychological abuse at first, often followed with sexual and physical abuse. So the target of the attack is the person's thinking, is their belief set. And you've got to take that apart.
Is there a facilitator who sits down with the mom and dad who's sitting down with the son who's in the cult type of thing? Is there a moderator? Is that how it usually happens?
Yeah, usually that's what the cult expert is hired for, right? Is to oversee the process, educate everybody involved with it so everybody's on the same page. You know, there's different approaches to this that different people have. There's no one uniform methodology, but the successful ones I've been involved with, or the ones that I've seen that have been that have gone the way we wanted them to, were an education phase, and you know, a kind of an agreement, let's get everybody on the same page kind of phase, and then there's the workout of how do we get this person to sit down with the cult specialist. And then there's the actual intervention itself, which can, it's so context specific that there is no general pattern because everybody kind of needs something a little different. Who matters to that person? Who are they going to listen to? Who do they feel safe around? Who do they not feel safe around? Because you don't want to have those people in the room, right? If mom and dad have blown it, then don't have mom and dad in the room. Because that's just going to be a distraction, you know. That's
so interesting.
We've
had some recent discussions about what would it be like to see an SE moderator between two people who have opposing views, and those two people would be aware that the moderator would be using a street epistemology approach, and we would be encouraging both of the participants to be using a street epistemology approach. I wonder if that would. I'm curious how that might play out, and I'd love to see some examples of that. But
yeah,